Good day to all and welcome. My name is Braulio Rosa. I am the Executive Director of the Broward County Bar Association. I'm pleased to have today with us Dr. Alison Clarke-DeSouza. Dr. DeSouza is being interviewed along with other doctors in celebration of Black history. This year, the 17th Judicial Circuit, Broward County Bar Association, and the TJ Reddick Bar Association are honoring frontline doctors and responders in the medical profession in light of COVID-19 pandemic. Welcome, Dr. D'Souza.
Thank you very much. Thanks for having me.
My pleasure. So, doctor, can you tell us a little bit about your medical specialty and why did you choose that?
Yes, my specialty is called obstetrics and gynecology. And the reason I chose that is as a medical student, you get to rotate through all the specialties. And when I rotated through, we call it OBGYN for short, I just fell in love. It was such a interesting specialty. I enjoyed learning more about myself. I felt that as being an OBGYN doctor, I can relate to my patients very well and they can relate to me. And I enjoyed delivering babies. The obstetric part is delivering babies and the gynecology part is taking care of women's health issues, and that's anything to do with their reproductive organs.
What special challenges exist for Black doctors to overcome in South Florida and in the nation?
I think when you talk about Black physicians in South Florida, I think it also pertains to the whole nation. And I like to compare doctors like we talk about the CEOs of corporations, we talk about the entrepreneurs who are mostly in areas where we're the minorities. And in order for us to make an impact and do the best things for our patients, we need to do what we say, be in the room. So that means you need to be active in your medical communities. You have to be the societies, all the committee programs that are available, because in these organizations, for instance, like the Broward County Medical Association, they liaison with our politicians in Florida. They're able to make policies and things that affect everyone. And if we are not at that table, then we will get neglected and our issues will not be addressed.
That segues perfectly into, can you describe medical care disparities and disparate treatment of Blacks in our healthcare system?
Yes, and now, especially with COVID, I think people are really noticing that there is such a thing as disparities among Black patients, because you see how COVID has been disproportionately affecting us. We are the ones who are getting the sickest. We're the ones who are dying, and it is rampant. And we don't know what it is. We don't think it's all socioeconomic, because if you look in my field, in maternal fetal medicine, the maternal mortality rate of Black moms at 4 times as much as in any other ethnic group. And it goes across socioeconomic lines. I think everyone has probably been familiar with what happened to Serena Williams when she was pregnant, what happened to Beyonce when she was pregnant. They had treatable diseases that if they were not insistent on telling their doctor that they need these tests, they probably would have died. But not everyone is educated like they are to do that. And that is why our mortality and morbidity rate is so high. So to counter this, we just have to really, again, be at the table. We need to start doing protocols. We need to do standardizations. When we look over the charts of the moms who have died, you start seeing what we call red flags. We always call it the retrospectoscope. When you look back, you can say, oh my goodness, how could we miss this? How could we miss that? So now if we set these protocols where we know what the major causes are, we know it's hypertension, we know it's cardiomyopathy. So we know that we want to place things in place that when patients start having these subtle symptoms, that we address it immediately. And if you look back too, if you see the conversations between doctors and their patients who succumb to this, they were telling them, but we just were not listening. And the major thing we have to do, we have to listen to our patients. And Black doctors, we're good at that, but it goes across the board. Some of the white counterparts, they're just so used to everything going one way. But unfortunately, with the African-American population, we have to look at subtle things. And once you pick up those subtle things, then hopefully we can improve those statistics.
It also sounds like you would recommend patients, whether they're Black, white, whatever it be, to speak up, talk to your doctor. Don't
Exactly.
just assume that he or she is going to know without you really
Exactly.
telling them how you're feeling and kind of insisting on certain things.
Yeah, in fact, the American College of OBGYN, they have a button that says, say something, we are listening, tell us. And we're wearing buttons to just encourage patients, because some patients are shy. They don't want to tell, they say, oh, they're just going to say it's pregnancy. No, it's not. These little subtle things, when you put these pieces in a puzzle, then now we'll know this is what's happening, and we can be on top of your care.
Well, certain ethnic groups, and I'm Hispanic, you're almost taught, and I know growing up, because well, the doctor knows everything, and
Right,
you wouldn't
exactly.
and you wouldn't question the doctor, which is a mistake.
Yes.
You're only human.
Yes, exactly.
And doctors make mistakes, just like lawyers, just like everyone in different professions. No one is perfect. So it is wise to question and ask.
Yes, I mean, you'd be surprised. I've seen patients that have a large scar on their abdomen, and I asked them, what kind of surgery did you have? And she said, I don't know. And I said, you didn't ask? Well, the doctor said I needed it, never questioned. So unfortunately, we don't see that anymore. But
Right.
Patients still don't want to, oh, I don't want to bother the doctor, or it sounds petty. And I try to enforce to patients, nothing is petty. You need to all your concerns, and especially now with technology, I tell them, when you leave the office, you're going to think of 10 things that you should have asked me. And I tell them, write it in your phone, and then we can address those issues.
Good advice. Good advice. So segueing into the past, Doctor, can you describe the legacies of Dr. Von Mizell, Calvin Shirley, James Sistrunk, and William Morris, and the impact on Broward County and its health care system?
Okay, so it was interesting. I had to look, I knew of them, and so I kind of look at their history. So I'm going to take them individually. So we can start out with Dr. Sistrunk, because he was the first Black physician in Fort Lauderdale. And he and Dr. Mizell actually started the Black hospital called Providence Hospital. So for people like me who grew up in segregation, there were hospitals that would not take Black patients. So what the Dr. Mizell and Dr. Sistrunk did is that they would actually do a lot of house calls, but sometimes patients needed to go to a hospital facility. So they started their own, and they were the pioneer who did that. And in fact, Dr. Sistrunk, they honor him every year with the Sistrunk Festival. And it's because of doctors like them, that's why our patients were surviving, as opposed to just going by the wayside and not being treated adequately. And then, in addition to starting the hospital, Dr. Mizell also sued the Broward County Medical Association, which is the medical association in Broward County, to accept him to become a member. And he had to actually get legal defense to do that. And it should have been automatic. As long as you're a doctor, you should become a member. And he started the NAACP. Dr. Mizell also desegregated beaches. And that same Providence Hospital, you can actually still see it. It's not a hospital anymore, but it is the Mizell Community Center that does a lot of great things. Now, Dr. Shirley, you might see I'm a little biased. I knew him personally. And he was really special. He just, we went to the same church, so that was a nice bond. And he was like those old doctors in the day. He would make house calls, patients, he would give them medication if they couldn't pay for it. They would say, here, take a chicken, take some apples, take some, because they were farmers, so they would bring all their little provisions and give it to him. And that's all he wanted. He didn't want anything else. All he wanted to do was to help. But the good thing, he did a lot of firsts, okay? He was the first obstetrician gynecologist in Broward County. He was the first Black physician on staff at Broward General, which I call it Broward General, it's Broward Health now. He and his wife established the county health department, which helped our Black community tremendously. And it was placed in the Sistrunk neighborhood. He also developed a curriculum for the Broward First School of Licensed Nurses, because he and his wife was also she was actually a nurse, and the two of them started this school for licensed nurses. Then he was the only Black at that time to receive the Heidemann Memorial Doctor of the Year. So that was a very prestigious award. And he served on the executive board of the Florida State Health Planning. So that was a really plus, because now you're really at the table and you can do a lot of positive things with that. And then we had the other doctor, I didn't know Dr. Morris as well. I knew of him, but he was all in that same thing. They all worked at Providence Hospital. They all served our population, our minority patients, and they all worked together just to build, they laid the foundation for us. That is why we are so successful now, and we know what to do to get things done.
So this is a perfect time to segue as it relates specifically to COVID-19 and the various vaccines being distributed. How can doctors and other medical care professionals convince Black community about the dangers of COVID-19 and the efficacy and safety of the vaccines?
Well, I don't think in the Black population we have to address much about how COVID has affected the general population. We know it's a deadly disease. I think, and I don't have a real statistic, but I would guess probably 90% of Black people have someone that they know that has been afflicted, and young, old, all strands of life. And so from his mother or cousin, and so it's heavily populated in our community. So that part, I think everybody realized it is something serious, something we need to do. However, they don't want the vaccine. And the reason is you can't talk about vaccine without talking about the Tuskegee Experiment. I think most people are familiar with that. I'll just briefly go into that. It's an experiment done in 1932 through 1972 in Tuskegee, Alabama, where they were looking at the effect of syphilis on Black males. So all the Black males who had syphilis were not treated, and they wanted to see how the effects on the body was. I mean, I have to apologize for my colleagues back then. That was a horrible, horrible experiment. And in fact, we're still feeling the ramifications of it now, because it's so hard to get Black people to participate in these trials. So on that line, a lot of the people in that participated in the phase 1, phase 2, 3 trials weren't heavily popular. I think they probably had maybe about 17% that were African American. So then trying to tell people, they say, well, that may not work on me. But you have to look at the data and you have to respect the science. And unfortunately for this past year, no one was respecting the science, and you had people who were non-medical personnel telling you how to handle a pandemic. And that was one of the things that really turned a lot of people off, didn't trust it even more. So and then on top of that, to call this whole project warp speed. You don't know how many patients have told me warp speed means that they must have cut something. They skipped the general protocols that you do before you launch a job, but they did not. And so we just have to keep just encouraging people, just take the vaccine. And most of us, they trust us. So I've had my 2 shots, and we just, I think that from the physician's point of view, we have to lead by examples, and we just have to say, look, I had my whole family vaccinated. I had, my mother, my father, and they had no problem. And I think once they start seeing that, yes, people are not getting sick from the vaccine, although there are few. I mean, everyone reacts to medicines different ways. So you probably have maybe about 10–15% people who actually do have flu-like symptoms, but it's like a flu. It's gone 72 hours tops. And then you're back to normal. But guess what? The best thing is now you're vaccinated. And we have to really get on top of this, because as you see, the variances are starting. And the longer this COVID sits and be a part of people who are not vaccinated, then it's going to have a field day of just changing to whatever it wants. And then it's going to make it harder for us to see if the present vaccines will give us protection against these newer strains. So it's still a big challenge. I mean, I have a lot of people that are still skeptical, and I don't know why. It just makes common sense to me as well as scientific sense, but that's a challenge that everybody just going to have to work hard at.
Definitely. Very important. Very important. So, Doctor, last question. What advice would you offer Black youth interested in pursuing a medical career?
Okay. Before I say that, one point I forgot to make with the COVID vaccine.
Okay, yes.
You realize that 62% of people in the United States who have received the vaccine are white. And that number is just very disturbing, since we are the ones who are affected most. So if you look at the breakdown of ethnic groups, the white non-Hispanics, like I said, are 62%. Hispanics are 8.9%. Asian non-Hispanic, 5.5%. Blacks, 5.9%. And the others are 14%. So if you took all the other ethnic groups together, bundled them together, that would be that there's only 34% that are vaccinated compared to 62%. So we just really have to just get our people out there, and just hopefully they'll listen to these numbers and see that they are frightening, and hopefully we'll get the vaccine.
What would you contribute that to? Would you say that has to do with certain ethnic groups fearing getting the vaccination, or the fact that the distribution has ethnic undertones where certain populations are purposely, or maybe not purposely, but underserved because they're not at the forefront of the thought of the people who are creating this distribution system?
Exactly, especially in Florida. Unfortunately, we are a red state, so the red privileged people were getting vaccines before us. And if you look at now that they are distributing now to Publix, Walgreens, but first they started with Publix. Now, if you know, in the poor Black communities, there are no Publix. So they just wiped out that whole population. They went to the villages. They made sure the villages, so they went to the more affluent areas to make sure that they got vaccinated. And then now they're trickling it down to everybody else. But now with the new rollout, I think that's going to be corrected, and it's getting, I think I heard somewhere that they're actually looking at Walmart to start distributing the vaccine. So once we get this widespread centers that easily accessible, and we're good at that. I mean, once, Black people, we take people to the polls to vote. Now we need to take people to get vaccinated, those that cannot physically go there. And we just have to, now that we have the vaccine, before we just didn't have it. So they're working on making sure we do have enough, and then working out the distribution in a scientific way. And so hopefully all of that will change.
Hopefully, definitely, because that's a terrible statistic.
Yes,
It
exactly.
really is.
Yes.
So back to my original question before we went off on this other thought, but it was good. It was good. It was very educational. What advice would you offer Black youth interested in pursuing a medical career?
The main advice that I would give them is you have to start early. You don't wait till your junior year in high school. Definitely you don't wait till college to decide. Medicine is getting to be more and more very competitive, and they are really scrutinizing these applicants. But on the flip side, there are a lot of resources that you could go online to kind of help you. You just Google, I call it Dr. Google, go to Dr. Google and he will help you. And they have some programs from ninth graders. Okay, this is what you need to do. You start getting interested in that. You should start volunteering. You should go to health clinics and see, is this something that you really like? And then if this is a passion that you like, then latch on. Black doctors, we have two Black organizations. We have the one in Dade County, which is the James Wilson Bridges Medical Society, and we have the James Sistrup, but they would both have merged. And the Black physicians here carry on the legacy of Dr. Mizell's, Dr. Shirley, is we like to spread our knowledge to them, our experience with them, to help them so they can just reach out to us and shadow us. Unfortunately now, COVID, we don't have shadowing anymore, but we won't be like this for long. And just don't be afraid. I see patients, and one of my patients who her daughter was thinking of becoming a physician, and especially most of us are in integrated schools, and we don't have that encouragement like the old Black schools. So she was not going to do it. And then I said, and we had a kind of long conversation, and she really had the passion. Her mother said she went home that night and she ordered her MCAT books to study. So she really, you just need that kind of pushing, and just reach out. We need to reach out. And of course, you do have to make good grades, okay? Unfortunately, you can't be going out all the time and going to the movies here. You got to make sure your grades are good, because that is pristine. I mean, you see kids now with 4.8, 5.2 GPAs graduating from high school. So you can't be, that 3.8 is just not going to make it anymore. So you just have to really be diligent about that. And like I said, volunteer and reach out to these organizations. We do have our Black physician groups that can help.
Excellent. Well, great advice, doctor. I have enjoyed our conversation.
Yes, it's nice. Yes.
Yeah. Well, thank you for spending time and educating me and our audience.
Good. Well, I hope they got something out of it, and get out there and tell your family, your friends, everybody get vaccinated. If anything I want to have a takeaway from this, go get your vaccinations.
And we'll end it on that. Thank you, doctor.
Okay. All right. Good.